This is a Fox News alert. The CDC confirmed today that the first case of Ebola has been diagnosed right here on American soil.
Today, we are providing the information that an individual traveling from Liberia has been diagnosed with Ebola in the United States.
All right, here to tell us exactly what this means for you and your family is Fox News Medical A-Team. Dr. Marc Siegel is with us. How are you?
Great to see you.
The one good piece of news is the cases that were brought to Emory Hospital in Atlanta were taken care of. In other words, people that had been working over there as aid workers. But now this is the first case that was actually here, that came here. How big a threat is this to people?
It's really not that different. I don't consider it a big threat. I know everyone out there is afraid of this, and I know why, because it's a killer virus. And I know we've been following how many people it's killed in West Africa. But the truth is, the difference here is that it came here on a plane, and he didn't have symptoms on the plane, and he didn't get sick till he got here. So the first question people want to know is, what if I was on a plane coming from West Africa? Sean, the answer to that is, if the patient doesn't have symptoms, you're not going to get Ebola. You could have TB on a plane. You're not going to get TB. Ebola on a plane, you're not going to get it by sitting next to the person, breathing their air, or even touching them. You can only get Ebola by very close contact with secretions. So then he got sick, and he went to the hospital. Well, when he got sick, he could transmit it. So the CDC is around now like Sherlock Holmes trying to figure out who he was close contact with. They're going to isolate these people, and that's how you break the back of this. That's how you keep it from spreading.
Okay.
We have the best healthcare infrastructure in the world here still,
but that's
even with Obamacare.
But the problem then is in Africa, because they have no medical infrastructure. And that's why these people are dying in such large numbers.
Big time. For every patient that gets Ebola in West Africa, 2 more people get it. That's never going to happen here. We understand isolation. We understand, we're afraid of this, so we're going to isolate people.
You think we will isolate? I mean,
this guy, I predicted.
Do you remember when we knew nothing about AIDS? We didn't know how it was transmitted. We had really no knowledge at the time.
Let me tell you the difference. I'm really glad you brought that up. The difference with HIV is you could transmit it without even knowing you have it. So people transmitted it, they didn't even know they were sick. It's very hard to stop that, and that's why it spread here. Here, you can only transmit Ebola if you're sick. So the CDC says, be on the lookout for these flu symptoms. Be on the lookout for someone that traveled to West Africa, suddenly gets a fever, suddenly gets very sick. Now, obviously, they also can cut off plane travel to these countries. That will be a big economic disaster. It may actually, for them, it may actually come to that.
Let me ask you this. Real quick, what about this mystery respiratory issue with kids in 40 states? Real quick.
Well, I've reported on that. I'll tell you about that. That's actually a pretty serious infection for kids with asthma. And now we're finding that kids may actually be at risk of getting paralysis from that in very small numbers. We're talking rare again. Because it's a kissing cousin, this virus, of polio. It's in the same general group of polio. It is not polio, but it is not a surprise that it could cause that. It's a nasty bug. It is a nasty bug, but usually...
How long will it take to recover?
Well, just about a week to recover. And usually after October, it starts to go down. Yeah.
All right. Dr. Siegel, thanks for...
Good to see you.
I'm glad you're on the job.
Fear is the biggest virus here, Sean. That's what we have to control.